Hey, it's Dr. Plank here. Hey, I wanted to give you guys a heads up that I am actually having a hormone balance webinar. And so I wanted to share with you the information of how important it is of what we're going to be discussing. So a lot of folks maybe suspect their hormones, maybe they don't. Unfortunately, medically, especially women, peri and postmenopausal, it's almost like a lot of docs, well, hormones don't exist anymore, right? You went through menopause and you're just sort of done with that part of your life. So let's not worry about them. Let's just stick our head in the sand and just not even and think about hormones as being an issue. Where guys, on the other hand, it's all about performance. So low testosterone, low T, becomes this little catchphrase, and that's a concern for their whole life. So it's one of those ones that, trust me, in working closely with individuals and making sure I want to get their hormones as balanced as possible. There is this awareness part of it, and also I'm well aware that there's this part too that's not necessarily, do I think, fair between the sexes. So this little sort of announcement, this little video here is just to sort of throw out so some of the symptoms that are affecting men and women. And it can be earlier and earlier in life we're seeing these things that can be disrupted. So for women, and again, it starts with the sort of the menstrual cycle irregularities is what draws a woman's attention to it, but also maybe PMS and irritability and headaches and back pain and cramping and those uncomfortable symptoms that probably more than a small amount of us as women have experienced at some point in our life. Um, some women are just happy when they meet menopause and go through menopause that, all right, I am done with that part and I don't care about hormones. I don't have any hormonal issues. That's just not true. If you had hormonal issues and PMS and those types of symptoms earlier in life, you are still meaning your hormones are out of balance. You might not experience those same symptoms, but you are going to have symptoms, and it could be vaginal dryness, still the headaches, it could be back pain, it could be irritability, it could be other symptoms, bone loss, that are chalked up to imbalances in hormones. You're just not aware of it now on a monthly sort of schedule. So for women, honestly, acne, bone loss, polycystic ovary syndrome, PCOS, endometriosis, moods, feeling moody, being told you're moody, depressed mood, fibrocystic breast disease. That also has a correlation to caffeine, but it's where the tissue of the breast becomes denser and it's harder during a mammogram to actually see the tissues more clearly. So foggy thinking, headaches, heart palpitations, heavy menstrual flow, hot flashes during menopause, increased body and facial hair. Ladies, that is a potential when we have these hormones out of balance. Again, irritability, low libido. Please don't just chalk it up to it's peri or postmenopausal. It just doesn't have to be that way. It is an important quality of life issue. And so if it's important to you, let's find out if hormone imbalance is behind it. Mood swings, night sweats is a big one. Urinary incontinence, fibroid, sort of fibroid tumors, urinary or uterine fibroids, again, vaginal dryness, and weight gain. So typically the focus is usually all on weight gain as a woman ages and sort of the PMS and menstrual cycle when they're earlier. But these other symptoms are always sort of creeping in and ebbing and flowing. And sometimes, boy, when a woman hits menopause, they just hit hard and they don't go away very easily. But each and every one of them can be an indicator of hormone imbalance. Now, for the guys, like I said, it's sometimes a little bit easier to get your doc to check hormones, at least your testosterone. But again, sometimes it isn't, depending on who your physician is, or what their comfort zone is, or what their recommendations are going to be. Guys, we're going to send, again, more towards a performance thing, right? But it's not just sexual performance. You're going to notice, hey, if you're going to the gym, you're not getting the same results with the lean muscle mass. You're not feeling as strong. You're not feeling as vital doing those physical things. You're also not going to feel like you actually can do them as easily, or your endurance is affected. You can't do them as long. Maybe earlier in life, you could really go to town with the free weights, and hit different body parts for much longer in a workout, and you're just sort of struggling to do that, but also noticing you're losing some of that muscle mass. So also for guys, you are going to have some sort of emotional symptoms that don't normally get correlated with guys. For women, it's going to be more mood and irritability. For guys, it's more apathy, like this unmotivated, I just don't care. I don't care. So if that's falling into your vocabulary, or it's, hey, when are you going to start to care? That's the time we should suspect that something is going on, and you might have a hormone imbalance. Feeling burned out, changes in your sexual performance with erections, decreased libido, just not feeling as sharp mentally, honestly. Just not feeling like, man, I got it going on anymore. It's sort of that awareness that it feels like age is creeping in here. The decreased muscle mass we talked about, the stamina, urine flow also, any type of dysfunction with an erection. Guys can also get hot flashes. So the hot flashes and night sweats classically are just sort of chalked up to women. But I'm here to tell you, with the foods and the obesogens and the hormone endocrine disruptors that we're seeing around us in our environment, in our food supply, these are the things that are really creating an estrogen dominance, meaning women can't get rid of estrogen, and guys, you are dealing with way more estrogen than you were ever built to deal with. Women, again, we're going to have the same hormones, but women are going to have a lot more of the estrogen, and guys, a lot more of the testosterone. But boy, with what's going on in the environment and chemicals and how our bodies are getting disrupted, it's our hormones and the cell receptors, the hormone receptors, that are getting bombarded by these endocrine disruptors. So again, irritability for guys, insomnia, infertility problems, right? Urinary problems, sleep disturbances, prostate, oily skin, heavy earwax is another one. A lot of thick earwax, oily skin, and also to weight gain. So again, guys, more the belly, women more sort of the hips and buttocks. So please, I'm going to include the link. I'm doing a webinar Wednesday, May 12th at noon. I'd love to have you be there, and I'm doing the same seminar Monday, May 17th at 6 p.m. And we are going to really focus in and delve into hormones to get a better understanding of what's going on. Yes, we do need them. They are vital throughout our life. And hormones, in essence, are the way our bodies communicate. That's exactly what hormones and neurotransmitters do. They leave one part of the body, they go to another part of the body, and they send a signal. So we want the different parts of our body talking together throughout the rest of our lives. So please join me. I hope to see you there. And again, any questions you have that you'd love to have answered in the webinar, if you want to respond and send them over to the office, I'd be more than happy to answer your specific question. If not, just pop them in the chat during the webinar. So please join me. I hope to see you there. Hormone imbalance, it's something we should all be concerned about. All right, see you soon. Take care.